Today I have the distinct honor of speaking with Dr. Anjana Samadder, the 42nd President of the American Association of Physicians of Indian Origin (AAPI), and Dr. Sumul Raval, who is the current Secretary and Vice President-elect. Founded in 1982, AAPI represents over 80,000 practicing physicians and serves as a vital platform for more than 40,000 medical students, residents and fellows of Indian origin in the United States. Through its initiatives, AAPI aims to enhance patient care, promote professional solidarity and enhance community service. Join us as we discuss the impactful work of AAPI and the vision with Dr. Samadder and Dr. Raval for the future. Welcome to ITV Gold Studio.
Thank you, and thank you for being that
Thank you for having us.
Pleasure. So, Dr. Samadder, starting with you, can you start by telling us a little about your background, how you became involved with AAPI and how it led to the presidency of AAPI?
I'm a practicing gastroenterologist in Columbus, Ohio, and since my residency days in Philadelphia, I joined the organization, and that was over 2 decades back. So as I went through all the community services and everything that this organization was offering the community, and both in US and India, I got really interested, and that's when I decided to get into the leadership role. So that's how my whole involvement with AAPI started.
Is there like a proper democracy and voting process, and the president is chosen in the organization?
Yes, we do have a proper election. It is it is contested. There's a lot of campaigning which goes on, and yes, there is a democratic process which goes on.
Wonderful. As the 42nd President of AAPI, what are your primary goals for your tenure?
Well, AAPI has done a lot of community services both in India and USA for the last 3 decades, and my vision has been to promote that. We do run free clinics, and we are trying to expand them in other parts of India. We also recently started increasing helping medical students, residents from India who are coming to this country, trying to establish themselves out here. In fact, we did sign a memorandum of understanding with All India Institute of Medical Sciences to promote research and work with other medical students and promote education in both India and US. Similarly, we are signing a memorandum of understanding with Thomas Jefferson University in Philadelphia to help apply for research grants and also to promote research and medical education in the United States. So that has been a prime focus that I've been focusing on, along with producing community services in both USA and India.
When you say that students who come from India, they can approach you, how do they even come to know about your organization? Are you guys famous back in India? Do you reach out to all the medical colleges and schools back in India?
Yes, we do that. Actually, we have alumni from most of the medical schools all over India, and we do hold a global health summit once a year in India, where we invite medical students from all over India for research projects, workshops, and this year we had it in New Delhi in All India Institute.
Wonderful.
And it was really well attended. We had the medical examiners board from USA, USMLE, and also the NBME. The presidents both attend the meeting there, and they talk to the students out there, medical students and the residents, to encourage, and it was very well attended out there. So yes, it's pretty well known, and it's posted on our website, and people can appear, go to our website and go and ask for help.
Wonderful. Dr. Raval, AAPI's mission focuses on facilitating excellence in patient care, teaching and research. How do you plan to further these objectives being a secretary of AAPI?
I think that's a very important question, and that's a very important project AAPI has, because my main goal as a secretary and later as a president of AAPI to involve younger generation of Indian origin physicians. If you count first, second and third generation of physician of Indian origin in USA, we have now close to about 200,000 physicians. And my biggest goal is to involve all the younger medical student, resident and fellow physicians to get involved into our organization AAPI from the very early onset, so that we can help, educate and promote research throughout from the very beginning.
Share some of the key initiatives currently being undertaken by AAPI to enhance healthcare delivery. Both of you can answer that.
Go ahead.
So, I'm very proud to say that every 7th patient in our country, United States, are being taken care by Indian origin physician.
Oh.
So that's a very significant impact on United States health care overall. We are in the process of developing a lot of healthcare policies, working with all legislators, both local and federal level, to impact meaningful healthcare, becoming more cost effective and research oriented.
Mm-hmm. Actually, we are, he's right, he's correct. We are working with different congressmen, senators, and we are trying to work with other Southeast Asian community physicians, stand together to work towards improving healthcare in the United States, fight all the issues that our patients and physicians are facing on a daily basis in order to provide good healthcare and productive healthcare to the patients without worrying about other issues like pre-certifications, prior authorizations, because those kind of things do provide a roadblock to physicians in providing care.
The AAPI Charitable Foundation runs free clinics and health fairs in India. Can you elaborate on the impact of these programs and any future plans to expand them?
Absolutely. We right now at present we have run about 7 clinics in India, and we are trying to expand into more. In fact, we have partnership in several other clinics, and we do provide free healthcare. We have done different projects like Adopt a Village, where a lot of our physicians have donated to their own villages, and we provide telemedicine out there. And also they get the basic screening procedures done on a yearly basis, and if there is any abnormality found, they are notified, and we connect them with different doctors and physicians out there. And we are looking at, actually we are in the talks of doing similar things in the United States. And because our next generation of physicians who are from this country, we want to do something for our adopted motherland here. So we are planning to establish some kind of clinic out in the United States, and we are kind of very excited about that.
That indeed sounds very exciting. So, Dr. Raval, the young physicians section and the medical students, residents and fellow section are a vital part of AAPI. How does AAPI support the development and representation of these young professionals?
So that is also a very important part of our organization, because as I said earlier, YPS, what we call Young Physician Sections, and MSRF, Medical Student and Resident Section of AAPI, are very crucial part of the AAPI, because they are kind of our future for the physicians of our Indian origin. MSRF started doing their annual events where they invite all the medical student and resident to prepare and present their research throughout the whole year in annual event. We just had in New Jersey in Rutgers University not long ago. And then similarly YPS also does a similar event once a year where they get together and prepare variety of different activities, including research, legislative talks, and all different kinds of academic activities.
Do you have grants for these young professionals?
So as a parent organization, we support to some extent, and then we will also, of course, have some sponsors who help us as well.
We do have some scholarship funds we offer the medical students. They can apply for that yearly, and we do approve that based on the qualifications and merits. Yes, we do.
What about mentorship? Do you mentor these students, especially who come, take them under your wing and they can like follow you in your daily works?
Yes, we do have mentorship program and observership and externship. They can apply through our website, and we match them with wherever they would like to go, whichever state, with different doctors, connect them with several AAPI members, and even if someone's not a member, we try to work with them and try to talk to the different hospitals and work with them to help them go and do establish themselves in those
Does it cost a fee or is it free of charge?
A couple of years back there was a charge because some of these hospitals do ask you for funds, but right now we are trying to subsidize it and not charge them anything.
Great. AAPI emphasizes community service and ethical conduct. Can you share examples of how AAPI members are making a difference in their communities? Both of you can answer.
So I think community service is a very important part of the AAPI. As I am very proud to say that during the COVID time, AAPI members not only in United States but also donated large number. We almost had donated close to $4+ million for all different activities, community services for Indian areas. So a variety of different activities done that, including donating the respirators, ventilators, oxygen concentrators, and variety of other medical facilities. So that is the biggest thing that we wanted to do during the community service project.
Wonderful. You'd like to add to that?
Yeah, we are trying to, on the same note, we are trying to, now we don't have COVID in whatever we had before, like the pandemic. So we are trying to, like I told you, we are trying to establish similar clinics, where we can help the community in the US. So we are working on that right now.
Wonderful. AAPI has strong connections with members of Congress and government officials. We touched upon that earlier. How does AAPI influence healthcare policy in the US?
Right now, we are working towards getting a seat in the Senate healthcare position. American Medical Association does have a seat there, but we do have a position out in the AMA where we do take our agenda and try to get it approved and go through them. Right now we are working towards AAPI getting that position so we can have a greater impact in the community and in the healthcare industry.
What kind of policies would you like to implement?
There are a lot of problems which faces physicians, whether they are in private practice or in healthcare, in the hospitals, hired by the hospitals on a daily basis, which inhibits them from providing quality care sometimes to the patients because they have to be worried about all the consequences. So we are trying to address those issues with the Congress and along with the AMA, American Medical Association, to see if we can try to make that a little more lenient so people can practice with an open mind and help the patients a little more.
With the ever-changing landscape of healthcare, what are some of the legislative priorities AAPI is focusing on to ensure patient-focused healthcare reform? You can answer that now.
So that is also a very critical point at present time because we have in the United States the best healthcare system in the world. As we always say, we have the best at the cost. We are one of the most expensive healthcare system in a country, in the world as well. So our focus is to help whatever way we can to reform the healthcare. I always say that, and many times people heard me saying that if you let me use my brain, I will cut your healthcare costs in 50%, just like that. But with the current system and liabilities that we have, we cannot use our brain alone. We have to use so many other things along with. So if we have that ability, we will be able to cut a lot of healthcare costs and make the healthcare more cost effective.
How do you stop the monopoly of the insurance companies or say the pharmaceutical companies in this line?
That's a ongoing challenges and work with pharmaceutical companies. I think we're getting to some end to success with some, but of course, when the other, as a researcher, I do a lot of clinical trials and research as well. So when you do the research, it does not come cheap as well. So there's a lot of avenues involved when you do the clinical trial and research. So when pharmaceutical company has initial cost of the medications, there is some reason behind those as well. But we are hoping that we can have affordable newer medication, affordable price to the patient who needs them the most.
And do you distinguish between what kind of medicines you want to give to them? Like whether it is like say Ayurveda, if you want to give them that, can you give that? Can you prescribe that? Or you just have to stick to what the pharmaceutical company or your degree entitles you to do so?
Right now we have to stick to whatever the FDA is approving, but medical schools both in India and right now several medical schools in the US are trying to implement courses of Ayurveda and homeopathy in them as a mandatory to graduate as medical as physicians. India is making it absolutely mandatory and US is also moving in that direction. So once that happens, I think that will be, in the positive direction. We all know a lot of that has had a lot of impact in the past and will in future too. And we are at this point also pretty excited that we are going to be looking into getting a lobbyist to work with the Congress and the Senate to work on healthcare issues.
That would be great.
Yeah.
So what are some of the biggest challenges AAPI is facing and its members today?
We do face a lot of roadblocks as physicians, like and a lot of issues do arise even in medical students. Mental health is one of the big issues that a lot of our students and residents and fellows have faced. We've had a lot of suicides amongst Indian medical students, residents, fellows, and even physicians. So we are giving a lot of emphasis on mental health because it is a very stressful job because you have to worry about your patients, you have to worry about consequences, and so that is something we are harping on a lot to make it easier for everyone so they can be stress-free, put them through different programs and address that issue.
Absolutely. Finally, on a personal note, what has been the most rewarding part of your journey with AAPI so far for both of you?
Well, for me, when you see a smile on a patient's face or someone gets well, that is very gratifying. And also when a medical student coming from India and they are struggling, some of them don't even have the funds when they get into a residency program, and the joy in their face and knowing they can do the same thing in future for for the community in future, these are very gratifying things for me.
Absolutely.
I think AAPI is the second largest professional medical organization after AMA. So I feel very fortunate to travel and attend all the local chapter meetings and different meetings of the AAPI in a different part of the country. And I had made some friends that friendship is lasting for life. And that is kind of very good connection to have people. Otherwise, I would not have able to see those people or meet those people. And there are amazing experience with those friends. And we travel to all different parts of the world as a part of the AAPI CME events. So that's wonderful opportunities we get.
So before we wrap, talk about the exciting convention or the event that is coming up in July in New York City. Talk about that.
Right. So we are having this for the first time. We are doing a World Health Congress. It's the first World Health Congress that AAPI is organizing at the Marriott Marquis in Times Square, July 18th to 22nd. The idea behind this was to rebrand it so that we can include physicians from all Southeast Asian and physicians from every walk of life. Because at the end of the day, we all need to stand together to address healthcare issues. And one of the major things, the way healthcare is moving, is with artificial intelligence. So that is the prime focus of our World Health Congress, and we are very excited to see that we have had people registering from England, Australia, India to come for this World Health Congress. And Dr. Raval will tell you a little more about all the exciting events. We want everyone to come and attend it, because we have some things for the next generations, for the teenagers, for little kids, so they can come and make it like a family event. And even though education, research, and there'll be CME talks, non-CME talks will be the prime focus, we have a lot of entertainment and very good food. So Dr. Raval, if you can say.
Sure, well, I get very excited to talk about our first World Health Congress, because we have very fun-full, research-full, and learn-full activities throughout the 4 or 5 days that we're going to have. Starting with having the current trend is AI in healthcare. So our main focus on this Congress is AI in healthcare, how AI is going to impact the healthcare. And we have invited leaders from all over the world in AI and the CEOs of those companies to give updates on how AI is going to affect the healthcare. We also have in our CEO forum all different CEOs from different pharmaceutical companies to give us update about how pharmaceutical industries are going forward with AI and how it is going to impact. We also have tremendous entertainment from Bollywood. We have Kapil Sharma live show will be there that entertain our members and non-members who will be attending our Congress. We have MSRF and YPS days where our young physician sections will be doing different activities. We also have a single section of singles match this time, first time ever, where we're going to have a lot of Indian physicians have children that also at the age where they are ready to get mingle with or find the life partner. So we're going to have events like those as well. We're going to do a research symposium where residents and young physicians are going to present their research, and we will give them awards of whoever. We will have amazing food for all these many days from Mogul Catering, which is our local here in New Jersey, and many more fun-filled activities throughout the 5 days. Wonderful. So I also want to invite everybody who is listening to this interview to come and experience our Indian legacy, Indian heritage and culture, and enjoy the entertainment along with education and research for from July 18 to 22nd in Marriott Marquis in New York. I also want to thank Padma Shri Dr. Sudhir Parikh and ITV Gold for having us in this studio and giving us opportunity to talk about our first World Health Congress. Thank you so much.
So thank you so much, Dr. Samadder and Dr. Raval, for sharing your insights and vision with us today. We look forward to seeing the continued growth and impact of AAPI under your presidency and under your secretaryship. Thank you so much.
Thank you so much.
Thank you for having us.